Two humorous nurses would like to acknowledge the true custodians of the land in which we record our podcast, the Yorta Yorta people.
We pay our respects to elders past and present and extend our respects to all Aboriginal and Torres Strait Islanders listening today. Always was, always will be Aboriginal land.
This episode is brought to you by eNurse, Australia's one-stop nurse shop, so head to enurse.com.au. eNurse loves our nurses.
Two humorous nurses with Kelly and Alisha.
The podcast that has never not made you laugh.
It's a double negative.
Yeah, I don't know what that means.
What? Welcome to Two Humorous Nurses, where we plan to bring you funny, informal, conversational chat about all things nursing.
Never have I ever hosted a podcast.
Liar.
Hey, well, we both get to drink. We're not allowed drinks.
We're drinking. We're not
no
allowed
drinks in the studio. Oh, the irony.
No drinking today, but plenty of laughs, hopefully, on the menu.
Plenty of laughs. So obviously we're going to do a Never Have I Ever nursing edition. I reckon this was a listener's idea.
Yeah, I think it was.
Literally like, yes, I'm onto this.
Great idea.
Right. First of all, we're going to go with the listeners' responses, which Alisha hasn't seen yet. So I'm going to
put me on the spot, man.
Yeah, and we're going to get going. Some of these hilarious.
Are they all nursing specific?
Yeah. All right, ready? Never have I ever got shit on my scrubs.
Yeah, probably.
Of course.
Yeah.
You want me to tell you a story about this?
Okay.
Not scrubs. Back in the day when you used to have to wear a nursing dress.
Oh, my God.
Nursing dress. That's how old I am. I, just before the end of my shift, had to clean up my patient who had diarrhea all in her bed. And we used to wear like little aprons to protect ourselves. And then, I was going home on the train and I was sitting on the train with a bag on my leg and the man next to me was like, and he was like obviously sniffing a lot. And I was like, no, I can't smell anything.
Is he doing lines next to me?
Yeah, like he's like full. And I was like, oh, that's really weird. Anyway, I get home and I like rush in the house, get to, because I like need a pee obviously, rush in, sit down on the toilet, and I look down and there's a strip of shit along the bottom of my dress from where the like apron hadn't got it. But on the train I couldn't see because I had my bag on my lap.
Oh my God, that's so funny.
So I have definitely had shit on my scrubs.
I just have to say something. After we recorded the poo episode, so Ollie has started telling me that she needs to poo. Well, she tells me when she's pooing and I have no fucking idea what to do. Anyway, the other day she tells me while she's pooing. And the other day she's standing with no nappy on, just like at the footstool playing, and then goes, "Mum, poo." And she's like pushing as she's saying this to me. And I'm like, what am I going to do? So I just pick her up. Literally, she shits the biggest log just into my hand.
Oh my God, that's so funny.
Michael! He's like, what? I'm like, I'm like, take the kid. And I'm just holding this like seedy log. Yeah, so.
Oh, fuck, that's funny.
I know, I just felt like, and then I was like, oh, we just recorded a poo episode too.
Yeah, could have done it a week earlier.
So maybe not on my scrubs, but yes, in my hand.
All right, never have I ever needed a towel to prop a huge 80-year-old's balls to stop them from being crushed when bedbound.
Crushed?
Have you never put like an old man on the toilet and they're like, oh, my testicles.
I haven't done that. I haven't. I feel like I can't say what I want to say because it's confidential. But I've used other things to put like the patient's own hand like down there
gently
while they're unconscious to sort of keep the penis out the way if it's really big.
Well, that will make them happy because, you know, it's how men spend their whole life, isn't it, with their hand down their pants.
Yeah, exactly.
My friend used to be a radiation therapist and she was telling me how they used to hammock the balls in masks.
That's great. What do they hook them to?
I don't know, tape them to the leg or something.
My God,
I don't know,
so
to do
funny.
radiation to get them out of the way of the
That is so
zapper.
great.
Yeah, too funny.
What about you? Have you
Oh, I mean, no, I don't think I've ever, like, you know, gently stopped someone's balls from being crushed. Never have I ever accidentally dropped my phone into patient's poo. Oh. It's got a crying face emoji and then in brackets, except I have.
No.
No, I haven't dropped my phone. I dropped my own phone into the toilet once. Yeah. And fell out of my pocket.
Yeah, that's happened to us all.
Post-pee, so that's, you know.
Lucky.
Never have I ever wished my colleagues a happy new year whilst performing last offices.
What's that?
Last rites, like on a – so when people die in bigger hospitals, you have to get them prepped to go to the morgue. Unlike us, we don't have a morgue. So you call that last rites or last offices. Like you generally – back in the day –
you're like, oh, Happy New Year.
Yeah, be like, oh, no, Rosie, like washing a dead body up. I haven't done that, but I've had many conversations. I've flirted over a dead body once.
Oh, Christ.
Oh, God.
That's funny. Oh, God, what?
Never have I ever blamed a dead patient for farting.
I haven't, sorry.
I also haven't.
How do you blame someone? You're like, oh, the gases are leaking out.
Yeah, I don't know. That was the same person that wished someone Happy New Year as well.
Yeah, right.
Never have I ever given someone saline to drink rather than water.
Do you know something I could never understand when I worked in theatre in recovery? They'd open little water ampules and squirt them into their mouths.
Yeah.
And I always thought it was so undignified. Like, I'd just get a cup. Like, we literally had cups and a tap behind us.
Put it in like a little medication cup.
No, I'd honestly just get them like a cup and put a bit of tap water in there. Like, it's so, I just found it so undignified, like squirting their mouths with like a water ampule.
I would actually never have thought that you could even drink it, but I guess it's just water.
Can. It's just like sterile water, I guess.
Yeah, like, or even...
But no, haven't. What do you open the saline for irrigation? You know, the big ones. Take a swig. No.
Yeah, that's. Funny. I mean, they'd know straight away, wouldn't they?
Yeah, bloody horrible.
Yeah, salty.
Gross.
Then the patient would be salty.
I've taken couple of little saline ampules home and used them as eye drops.
Oh yeah.
And then sometimes you taste that.
Yeah, because it runs down the back of your throat from your tear ducts.
Yeah.
I don't know if the other ones I can actually say on here. They're that gross.
Okay.
It's not really. Right. What about you? Let's just go one for one, hey?
Okay. Recapped a needle. Never have I ever recapped a needle.
Well, of course.
I know. I feel like
what about recapped after it's been in a human's body?
No, I was going to say I've never recapped a dirty needle.
Never.
Only ever.
And I can actually say that for someone
Me too.
Yeah.
I have very strict work standards.
In some areas, same. In other areas, whatever. Yeah. All right, and this is the whatever one.
Okay.
Never have I ever counted rest rates for every patient, every set of obs for a whole shift.
Nah, I haven't.
Nah, 16.
I'll say, like, when you do your baseline, I will say when I work in urgent care, I do rest on every single patient because I feel like, well, unless they're there for like, maybe not. Unless they're there for like, I don't know.
Also, my thing is when you need to, you will.
You do. Yeah, exactly.
Like, I'm not looking, and I get that rest rates are like if I go to a patient and I do the first set of obs, and especially in my department, like the ambulatory patients, and they're breathing normally, and then I go back and they're like halfway through their second bag of blood, and they appear to not be breathing normally, then obviously I'm going to be like, what's wrong with you? And I'll be looking at the bigger picture, not just their rest rate. And then I know people will be like, but you have nothing to compare it to. And I'm like, I can, because I can already see that they're now in distress.
For me, it's more like detecting trends early.
Yes.
But
also 16 is not a normal rest rate. 16, 17, 18 are not normal rest rates. Most people breathe at around 12.
Yeah.
But if you wrote 12 down, people would lose their mind.
No, yeah, it depends what it is. But I will say that I prefer to do rests.
Now, do you do a whole minute?
No, I do 30 seconds and double it, which I know is not best practice, also patients know when you're staring at them for a minute, their breathing changes.
Yeah, just do it from away.
Yeah.
at the end of the bed while you're writing notes.
That's exactly what I do. And then they're like, why are you looking at me? And they start looking down at their chest.
Yeah. Or like you have your hand on their shoulder or something.
Yeah.
And they're like,
why are you touching me?
That's a long touch.
And why do you keep looking at the clock and they're looking down at me?
Oh, that's funny.
I've never swapped a shift then called in sick.
As she sculls her bottle of water.
I can't remember a specific incident, but I'm pretty sure I would have done that.
Of course.
Yeah, and then, or when someone else does it to you, fuck, you're pissed off. You're like, I swapped that shift and now they've gone and called in.
I know.
Because they wanted it.
Yeah. Yeah, that's right. You went out of your way to help them.
Yeah.
Arseholes. You could have just called in sick on the shift that you're on.
Yeah, exactly.
Never have I ever done CPR.
I have.
Yeah, of course you have, you shit magnet. I have too. I've done it once.
No, I've only done it once, specifically. Like, I've only done compressions once.
I wasn't even like a registered nurse. I wasn't even an enrolled nurse, I don't think. Maybe I was an enrolled nurse. I was working in a nursing home.
I'll say I've only done it once, but I've had a lot of clinical emergencies, but only one that was like a full-blown cardiac CPR.
Yeah, you get a lot of respiratory and
I get a lot of respiratory arrest. Yeah, I do, literally. And arrhythmias and stuff, but none only one that had resulted, and that was a PEA.
Oh, yeah.
Yeah. So that was the only one.
The one rhythm that fucks everybody over in ALS.
Yeah.
But I'm so wary of it now that I was about PA, and they're like, no. I'm like, okay, that's fine. Move on. Yeah. Just in case. It's like
Is it me?
Yeah.
Never have I ever cracked it and gone home. Oh. I have. Probably more than once.
Cracked it and physically left your shift?
As in cracked the shits and left.
Early on your shift?
Yeah. During my
So
shift.
I've cracked the shits and left, like in theatre once, a doctor threw a pair of scissors at me and I cracked the shits and walked out to the manager's office and were like, go in there and tell him off. But I went back in there.
Oh, you're a good
Like I didn't leave.
I'm not proud of it. I'm not saying.
What? Yeah. Interesting.
One of them was fairly recent and I was annoyed mostly because I was in pain. I did the wrong thing, technically. I probably should have called in sick before my shift.
Yeah.
But I thought that I would have been able to handle just not walking as far.
The whole ward.
Yeah.
Yeah, because that ward's pretty long if you get
it is, if you get
side.
the whole side. Yeah. So, definitely not proud of it, but it is what it is.
Yeah, exactly. Never have I ever changed a tracheostomy tube.
Yeah, I have actually.
Yeah,
I've changed a few. My Olpa actually had one.
Did he?
Yeah. So he had massive oropharyngeal surgery, nasopharyngeal surgery.
Yeah.
And he had a trachea for a few months actually.
Yeah.
Yeah.
So I was on the first ward that I ever worked on as an EN. I became an advanced skills EN, and one of the things we could do was look after trachea patients post big head and neck surgery.
Sometimes the trachea is easier to manage than people with their own throats.
Yeah, tracheas just gross me out because I don't do phlegm or saliva or anything. So it's and people still will always cover their mouth and not their trachea.
Yeah.
But I remember when I was learning to change the trachea, they have a man who's would come in and be like the guinea pig for you. So he had a long-term trachea. So there was no risk if you took it out, the rush to get it back in, it's not going to close over. Mm-hmm. And he was like the person that they called when they needed someone.
That's cool.
Yeah, so there was 3 of us learning that day, and he come in and he was so lovely, and I took the inner tube out to clean, and then I had to take the outer tube out to replace it. And as I took the outer tube out, he pretended to have a spasm in his throat and was carrying on, and I was freaking out. And I was and I just grabbed the clean one and put it in. I don't know why. And then later, and I was thinking, oh my God, I've
killed him.
Hurt him, I've damaged him or something. And then they just laugh. And I was like, you assholes. And she's like, no, you did exactly what you should have done. You didn't panic and you just put it back straight back in. And I was like, oh, was that planned?
That was a test?
Yeah. And he's like, as he's holding his voice thing, he's like, we do it every time. And I was like, you fucking assholes.
There was, I did look after one other one as a student, and this boy used to cough, and he'd cough so much and then it stopped coughing, and then you'd hear this
thunk.
Because
the little thing.
it was like would like cough, whatever the mucus would just like come out.
It's nothing like suctioning a trachea, like when you learn to suction and they're like, you know, don't have it on have it on suction when you put it down, but then no suction or whatever the opposite way around.
The other way, and then you twist.
And then you like, because they're like when you're suctioning they can't breathe, and you're like, especially if you take a little bit too long and they're like,
you sucked all the air out of their lungs.
When I was in when I was doing my pediatric placement, I was on the like infants ward, so it's like 0 to 12 months, and there was a baby that had been born in the country, and they had damaged his trachea, and he had a tracheostomy, and I was like, oh, my baby. So I'd been allocated him to do a case study on, and I was like, oh, my baby barely ever screams. And then when I was like, the nurse was like pointing at him, and I turn around and he's just like lying on the bed like crying, but you can't hear anything because he's got no like, it's all coming out his trachea tube. It's not and he's like his eyes are like
vocal cords.
So doesn't really reflect on a podcast, but I was like it was really and I was just like, oh my god, that's terrifying.
Never have I ever made a medicate. Let me try that again. Never have I ever made a
welcome to my world.
Made a medication error. Never have I ever made a medication error.
I mean, we've all made a medication error.
Yeah, of course we have. Tell me about one of yours. And I'll feel less guilty about mine.
I gave a drug many years ago, again, when I was an enrolled nurse for a patient. It was like octreotide or something, but it was brand new at the time. And it was like, you had to draw it up in a syringe. Make it up with fluid, draw it up in a syringe. Anyway, as I'm standing there reading shaking it with the fluid, reading the thing that says, gently roll vial backwards and forwards for 5 minutes, and then in big letters, do not shake, as I'm literally shaking it. And I'm like, oh, fuck. And it had all crystallized in the thing. It was like $8,000 worth of a drug.
Oh, but you didn't give it to the patient.
No, but I fucked it up. I think probably the worst thing I've ever given to a patient was like I gave the wrong like brand of a drug and
it mattered which brand you were supposed to give.
Well, it turned out it didn't matter, but it was labelled incorrectly by the blood bank. It wasn't blood, but it was labelled incorrectly by the blood bank. So it wasn't until the patient was like, oh, am I supposed to have that one?
Yeah.
That's not the one I normally get. And I was like, oh my God, because they were both on like 55 grams.
Yeah.
But it was I'm not going into too many details because it's like.
Yeah, of course.
Yeah, but there was no harm done.
Of course, yeah.
I don't think I've ever given anything that's caused harm.
No, I haven't either, fortunately. I did give Clexane when it was supposed to be withheld.
Oh, I remember you telling about the patient that had that temporal.
Yeah, she had temporal artery biopsy. Anyway, she was fine. And it's the whole open disclosure. Like, you tell the patient you feel terrible. You tell the doctor. You tell the family. You bloody ring every 4 hours overnight and make sure they're not dead.
But
But it was one of those things like they give Clexane 6 hours post-op anyway. So it was only that the doctor wasn't sure what time she'd come back. So she'd put withheld and I just didn't see it and whatever.
I've given like drugs at the wrong time of the day. Things like that. But nothing.
Whoops.
One of my
You're getting that early today, love.
Yeah. Never have I ever had somebody else's bodily fluid in my mouth.
Oh, I have a great story about this. Yeah. When I was a grad, I had a student and we were taking out a suprapubic catheter. I'd probably only ever done it once, if I'd even ever done it. And I was just telling her, I was like, just take it out slowly. Well, she took it out, whipped it out.
Oh.
The thing went flying and smacked me in the face. And I got urine all over in my eye.
Physical response here.
So it wasn't in my mouth, but it was all in my eyes.
Oh, still.
So I had to go and do like a little eye shower. And then because I'd been exposed to bodily fluids, we both had to go through the whole
rigmarole.
Yeah, like blood testing. And anyway. It was fine. Oh, I'm fine.
That's gross.
And the student felt terrible. And I was like, she was like, oh, I'm so sorry. And I was like, yeah, well, this is what happens when you don't listen. Like, I was probably not feeling my most supportive. I was just angry that I've been splashed in the eye with piss. What about you? Have you had someone?
No, I haven't, thankfully. But I watched a junior doctor who was debunking a carbuncle on someone's back.
Gross.
And I'd set the patient up ready to go, like on his bed, leaning over his heart table with a pillow. And like you could see this thing was ready to blow. Like it was the best Dr. Pimple Pop. Like it was the size of my fist, right?
Oh, God.
And the junior
Just
doctor.
doing it on the bedside.
Yeah, because it was so superficial.
Oh, yeah.
And the junior doctor was like, she'd put on a gown and like a mask, but she hadn't put on eye protection.
Oh,
and I said to her, would you like some eye protection? Because I had everything on, right? This is pre-PPE, like pre-COVID. Like this is like in the early 2000s. And she's like, no, I'll be fine. And I'm like,
okay.
Okay,
say I
no
didn't
problem.
warn you.
And she just says to the man, could you just lean a little bit more forward? And so he's gone to lean forward, he's actually put both his arms pulled his arms in front of him.
To make it more taut on his back.
No, I don't think he's meant to. I think he's just like to lean onto his pillow. But doing that has put
more pressure
on his back. And as she's just put like the needle, like she hadn't even put a scalpel. She'd put the needle in to put a bit of local, and it has just exploded.
Oh my God.
And like hit her in the face. And I laughed. And he goes, oh my God, that feels so much better. She, like the horror on her face was epic. And she just left the room, and I was like, trying to clean up this wound that was just leaking everywhere. It didn't need debunking. It just needed popping.
Yeah.
Funny.
Never have I ever made a patient give their own enema.
Of course.
Yeah, of course.
You're capable. Do it yourself.
Exactly right.
Yeah, lesson there. Your patient.
Yeah, write that down, all you nursing students. Well, if they were at home, they'd be giving their own.
Enemas.
If they were capable.
Have you ever given yourself an enema?
Fuck yeah, mate. Do you know how constipated I get? After I had my tonsils out and got an infection, all the drugs, like the endone just constipated me. I was like, I went to the local chemist, and because our local chemist used to supply the hospital, I was like, Rory, you got to help me. I need something. Like, I'm in tears. And he's like, okay, calm down.
Would you like a Microlax? And you're like, 5 of them?
Yes, give me a whole box. Tell you what, fuck me. That is almost like giving birth. Awful.
Oh, gross.
Anyway, next. Oh, my turn? No, your turn.
I know. Yeah. Never have I ever vomited at work in front of a patient.
I don't vomit.
What?
I vomited. The last time I vomited, I'm like Jerry Seinfeld. I can almost remember the date that I vomited. The last time I vomited would have been 10 years ago. I had food poisoning. I vomited once.
Stop.
And then the time before that would have been 10 years before that. I can't even make myself vomit, dude.
I vomited the other night just because I didn't swallow my hot dog well.
Oh, my God.
Yeah, I'm a vomiter.
You are a vomiter.
I vomit in the car from car sickness, driving myself. When I was pregnant, I just had Ziploc bags everywhere.
Oh, my God.
Like, yeah, I can be driving and get motion sickness and just Ziploc bag it.
Oh, you poor bugger.
The other day, I don't know where I was coming back from. No, back from Melbourne, hungover, thanks. And I was driving up the Hume, and I had stopped at Wallen, and I got an iced coffee from Macca's, and I was just driving, and I was like, oh no, I'm going to be sick. And I only just had enough time to pull over and like lean out the door.
Oh my
and
God.
puke up the like iced coffee.
Ew.
Oh, it's the fucking worst.
My body just keeps everything in. Doesn't want to let anything
clearly
out.
constipated.
Even like one time I ate so much ravioli that I like couldn't move. Like, and I was like, normal people would spew. Like normal people's bodies would be like, you've eaten too much, and I don't know why I got a main instead of anyway.
Speaking of iced coffees in the car, which is pretty much the only place I drink coffee these days, I wish that I had a decent travel mug for my coffee.
You mean your trimethylxanthine?
Yeah, fuck. Do you know how many times I tried to say that?
Have you seen the range of travel mugs and water bottles from eNurse?
I actually have, which is why
you can't say trimethylxanthine.
Yes.
Or they have
Yeah.
a caffeine prescription coffee mug. Oh, you could put your margarita in it too, I guess.
Yeah.
Do you often drink margaritas while you're driving?
No.
The Elite Care stainless steel coffee cup comes in black and white and keeps drinks hot and cold.
Wow. No. Nurses need a cup that will keep things like hot
or cold.
Hot or cold, because we know nurses love a nice coffee.
And you actually,
Cold brew.
your coffees always end up cold by the time you get here. I don't know how you drink them. Like you buy them at home and then
I
travel
drink
40
my coffee
minutes.
for the entire morning.
Stone cold.
Yeah, mate.
Gross.
I buy it, drink it all morning. It's even worse now we're in N95s because I can't just like pop
drink
it
less.
down. Yeah. Yep. So I've been
you'll
getting a
have to
smaller
get-
size. So
You'll have to get a travel mug from eNurse.
I know. I mean, obviously as nurses, it takes ages to drink your morning coffee. And they're really great value. They're only $18.95, which
That's
for a
cheap.
decent travel mug, which looks cool with like a coffee prescription on it for your
There's heaps of them.
trimethylxanthine. I don't know how to say that. That's the scientific term for caffeine.
I didn't know that.
Me either. Thanks, eNurse.
eNurse is Australia's leading nurse shop, specialising in everything that a nurse would need to survive every shift. From high quality and stylish nursing scrub sets to handheld study guides and nursing equipment, we are truly a one-stop shop for everything you need.
Head to eNurse.com.au. eNurse loves our nurses.
Right, back into it. Never have I ever changed a patient's sheets just so that they'd get out of bed.
Oh, mate, I used
totally
to
done
change
that.
the sheets. I used to take the sheets off the bed.
Yeah, and
make
then
them
leave
sit in
them.
the chair and then take an hour to come
I
back.
shouldn't say leave them. I mean, like, if
Encourage them to sit out of bed.
It's some people just the whole pajama paralysis.
Mate,
they just sit in bed,
Yeah.
and you're like, "Are you going to get out of bed today?" Oh, I think no, I don't think so. I'm like, "Oh, well, I want to make your bed, so hop out, and
Yeah.
then I'll strip it, and then I'll
Yeah.
come back an hour
And
or
they
so
have-
later."
And like a lot of times they have the most comfiest chairs next to their
yeah,
bed.
exactly.
Sit up.
I don't get it,
Anyway, me either. I'm like,
especially if they got pressure sores and shit. You're like, "Get out of bed."
get out of bed. Or get up and walk to the toilet. I'm not
Yes.
panning you, mate. I just changed your sheets. Never have I ever ridden in an ambulance with lights and sirens on.
No, I haven't.
Oh, me either.
I'm going to touch wood here, but I've never even been in an ambulance.
I've never, like,
I've just looked in them like when I've
I know.
handed over to patients or I've
Yeah.
had to run out and give them paperwork and stuff.
come to pick up your family member or something.
Mm.
But I've not ever. I've never stepped inside one. My kids stepped inside one when they came to the school to
Oh,
have
yeah.
I never got that when I was at school.
Well, I've been in and looked around because our local.
If anyone has
ambos-
an ambulance, if they could just come and bring one around so I can have a go and have a look and push the button for the siren. Love that.
never
Maybe
have
Mike Fox can come visit us. Bring his ambulance.
never have I ever told a patient they'll die if they don't turn their life around. You're looking at me like, what are you going to say?
I don't know, but my lung cancer patients always ask me if they should quit smoking. And I say, too late now. But I do give them a quit pack. Yeah. Doing my duties.
Doing your duties. I wrote this because I have.
Yeah, I bet. I
Yeah.
bet you have.
Just the
In
same
urgent
patients
care.
coming
Oh.
with chest pain, and I'm like, stop fucking smoking and do something about your life. Like, what are you doing? And then like ends up with a quad bypass, and like I'm like, one day this
Told you
isn't going to be a
so.
false alarm. Like,
Yeah.
sort yourself out, mate.
My granddad told me a story.
Doesn't
once.
take his medication, stuff like that. And you're like, come on, stop coming
Non-compliance.
here when you've got chest pain. If you took your medication, you probably wouldn't.
Yeah, please don't stop coming though.
Yeah, well, I know, and that's the thing. Like, it's so hard.
Stop coming on my shift.
But then I know, and that's the thing. He would come on my shift every time. I'm like, how many times are we gonna have this conversation,
Yeah.
mate? Come on, take your fucking medication.
Yeah.
Like,
My granddad was an orthopedic surgeon, and he told me this story once about a man who jumped off a bridge, broke both his legs. He was trying to commit suicide, and he, like, after he fixed him, had said to him, "You know, there are better ways to end your life, and jumping off a bridge just gets me more work. Like, firstly, the footbridge wasn't high enough." Like, and I remember him
won't be
like,
taking the footbridge anymore.
yeah, like I was like an early teen, and like, I mean, he told me lots of things I probably, shouldn't as an early teen knowing.
No.
But anyway,
Yeah.
yeah, and I was just remember thinking, are you allowed to tell people that that's a dumb way to die? Like, anyway.
We're just quoting previous episodes.
Really. But yeah, no, I've never. I mean, I don't think I've ever told anyone to like turn your life around. But I have given people advice, like especially patients that come through urgent care with like huge anxiety and and things like that. Given them, you know, like you really need to make changes in order.
Yeah, absolutely. And that was, I mean, when I say it in, I say it in a lot more words than that.
Oh,
like
yeah,
not like you need to turn your life around. It's more like, you know, these are choices.
Help
like you
yourself.
have opportunities and these are
right.
choices that you're making every day.
Yeah.
And unless you start making different ones, like, you know, you could be looking at having a heart attack or like, because, I mean, and you do get a few patients like with the real non-compliant diabetics and stuff. And you're like, I've seen patients with like horrific complications from their diabetes.
Yeah.
And they've been
all preventable.
Which are all preventable. And, you know, when I say we're going to have to send you to another hospital, like, you know, you'll potentially have an amputation, like they're shocked.
I know.
And I'm like, this is something that you would have been told
at some point
over and over and over. And, you know, there's a reason you're prescribed medication and there's a reason that you're encouraged to check your sugars and see a diabetes nurse. And, you know, there's reasons for these things. Like, and it makes
some people don't make change until they hit rock bottom.
Yeah. Which rock bottom could be losing a foot.
Yeah, exactly.
Yeah. It's hard to find that balance though between like being compassionate but then also being like, how many times are you going to come here? How many times am I going to tell you the same thing? How many times like are you going to...
I guess that's our job though, just to keep doing that.
Yeah, exactly right. Exactly. Yeah. And it's hard to find that compassion.
Lead that horse to water.
Yeah, exactly. But it's hard to find the compassion when it's choices. Do you know what I mean?
Yeah.
Like sometimes I have to really dig deep to find that compassion.
Just in general.
Just sometimes.
Never have I ever got scared when doing last rites of a patient because they moaned.
No, not moaning, but sometimes when you turn them, they leak stuff.
Yeah, I remember we had a patient and they'd only they had died, like literally had just died, and the family weren't coming in. So we had sort of done the wash of the body and as we were rolling it on the side, she obviously had like a lung full of air, and as we rolled her over, she went,
oh!
And I was like,
is that the spirit leaving her body?
Speaking of spirits leaving the body, one time we had this patient, she'd been on our ward for months and months and months, and I'd gotten to know the family really well. Like they gave me a fondue set. Like,
oh, I think you've told this story before.
And I was standing with the husband, and she'd had like these couple of really bright days, and when I came in, she was unconscious, like she was she was end of life. And I was standing there with the husband, and I was just holding her hand, and I was saying to him, "Oh, like I'm so sorry that, you know, she's been in here for so long." And he was just saying how lovely everyone had been to her, and, you know, he was happy that she was really comfortable, and he was okay if she passed away. And we were just standing there, and we were just having this really lovely moment because, you know, I'd nursed her for so many months. And then she just, like, I was literally holding her hand, and then I just felt this whole big shiver through my body, like literally up through my body and out my spine. And I was like, oh God. Like, and I was like, oh, and like my whole body even now started tingling, and I like had let go of her hand. And he's like, I don't think she's breathing. And I was like, oh my God, she just left through me. Like,
oh my God.
And I was like, oh. And she was so calm, and she was like not breathing.
Did you have any
and
feelings other than terror?
I know, I was just like, oh, that was so weird, because I was like holding her hand. But we always had this nurse that would go around and open the windows of the room. She's like, don't trap them in here. Yep. But that was back when you could open hospital windows. Yeah. I don't know if you can anymore. No. But yeah, I was like, oh, like it was creepy. Very funny though. It was cute. She was lovely. God.
Never have I ever refused to treat someone.
No, I haven't.
It's a complicated one, but sometimes we don't treat people like we have frequent flyers. So we'll be like, you're not coming in until we call the cops.
Oh, yeah.
Or you're not coming in until we call security, or you're not coming in. Which that's like hospital.
Call an ambulance.
Policy now. Yeah. Depending on who it is, like because they've been abusive and because we're isolated and.
Yeah.
Different if they're coming in arresting or something.
Medical,
Totally
yeah.
different. But most of the time they're just coming in and then you can't get rid of them.
Yeah, that's right.
They go and help themselves to a blanket from the blanket warmer. And you're like, you can go down. They're like, no, wake me in the
Sandwiches
morning.
and a cup of tea.
Yeah. How many more have I got? Oh, this is it. Never have I ever taken bloods from a cannula when it should have been venipuncture.
Oh, I mean,
I'd say not many, but
if any, not many. No. I only take bloods from a cannula when I put the cannula in.
yes, same. But I will say there's probably been 1 or 2 times when I've taken blood from a cannula.
How old's the cannula though that you've taken it out of?
Less than 8 hours.
72 hours. Yeah. I mean, what does it matter then? Does it matter?
I don't know, but normally they just tell you it's best practice to do venipuncture, so that's what I do. And then if I don't, I feel really guilty about it afterwards.
It really annoys me though when my patients with pig lines or ports go to your ward and you still take blood.
Don't look at me, mate. Don't look at me.
I'm looking at you because you're in the room with me. No, I mean, we don't take a lot of, our patients are only in our
No, you're right. Yeah.
area. But
And you just take the bloods when you access or
yeah. And prior to working here, we would never have taken blood. That's what pathology is.
But I would only ever do that in urgent care. I'd never do it like on the ward. Because those cannulas are old and manky and been in bed and whatever.
Yeah.
And it's only ever from a cannula that I know I've put in. I think I'm just going to say no.
Oh my God.
I'm only saying because I've probably done it once in the last maybe 5 years. So I feel like
sometimes
I have
it's just
done
as
it.
easy to like put
A needle
a needle in and do it because I don't know. I accessed someone port the other day and then the port wouldn't give me blood. I was so annoyed. So I accessed a port, wouldn't give me blood, and then I had to do it venipuncture anyway.
What do you do in that instance? Do you just flush it, the port? Can you still use it if it's not giving you a flashback?
It gave me flashback. It just didn't give me blood. It just wouldn't flow. Like I got blood. I actually got off 4 meals to discard, and then when I went to actually collect the blood, it wouldn't come, and I was like, oh God.
I could see your
annoying.
frustration.
Yeah, I was really annoyed. Oh my God, that was hilarious.
That was funny.
That was funny.
Let us know if there's something you've done or not done that you want to throw in the ring for next time. We were saying this would be a great format to do like for a live or something.
Yeah.
Don't forget to give us a 5-star rating on your podcast platform and then other people can find us.
Yeah.
It really does actually help with the algorithms, however they work.
Yeah, I don't know how they work.
Give us a follow on Instagram at 2 Humorous Nurses Podcast.
We've had some really lovely emails lately.
So nice.
Yeah, keep sending them through. We love them. hello@twohumorousnurses.com. That's humorous like the bone, HUMERUS. Also, tell a friend. Tell
this could be your
someone.
homework this week.
Tell someone you know about our podcast, or share it on your stories and tag us because we bloody love that stuff too.
And we share everything we get tagged.
Yeah, we do because
Why not?
why not?
Because there's not that many.
Yeah. Thank you if you tag us. Yeah. And yeah. All right. See you next time. Bye.
Bye.